60 million people in the United States for whom English is not the first language. Out of those 60 million people, 30 million people don't even speak the English language. It gets hard for them to voice their concern to improve the quality of healthcare. I'm from India, and English is not my first language. I came here to this country, to Fargo, as a college student, and I liked it so much that I decided to stay here. I like Fargo because it's so innovative and supportive of startups. The idea behind Meditex was actually started last year after the startup weekend. In brief, Meditex is a simplified electronic patient feedback system where patients can take a short survey over the tablet devices. Now, before I move on to my innovative product, I want to address a few issues with the current systems. Currently, the patient survey systems include paper-based survey systems and the phone-based. The problem with these kind of survey systems is that they don't support multiple languages. It takes them 2 to 3 months to get the results back to the provider. That's a long time. And think about all the paper wastage from the paper-based surveys. Add to that the cost of postage, printing, and mailing. This brings up the cost for healthcare. We did a research here in Fargo in a clinic that uses paper-based surveys, and we found out that they see around 900 patients a month. Out of those 900 patients, they get only 10 to 20 surveys completed and returned back. That's a very low number. Since our 1 million cups presentation, we started testing our product at Stanford, and it was interesting to see that they were able to exceed the completion rate in just 2.5 days, which was really interesting. Let me tell you a little bit about how it works. So while the patient is in the clinic and they are making the appointment for their next visit, they take a short survey over the tablet devices by selecting their preferred language amongst the multiple languages. Then they select their provider based on the picture that they see. The survey guides them through the rest of the process, and each question has 4 universal icons and an actual comment at the end. We have audio feedback for people with visual disabilities. In our testing, we have 30 questions for our surveys, and we set a goal to get the average completion time for each survey under 5 minutes. And I'm so excited to tell you that we found out that our current average completion time for each survey is 20 seconds. The current age group of people that are taking those surveys, average age is 80 years old. Meditex is the future of patient survey system, and I want to make it available not just in Fargo Moorhead, but the entire nation. Thank you.